Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Forensic Medicine, and today we'll continue with regional injuries. In that, we'll discuss about injuries related to chest. So, chest injuries can be non-penetrating or penetrating injuries. In non-penetrating or closed injuries, in these injuries do not open up for any part of the thoracic cavity, usually caused by the blunt force. So, usually any blunt force injuries on the chest can lead to non-penetrating injuries in which the thoracic cavity is intact. Penetrating or open injuries that damages the parietal pleura, it will produce an open pneumothorax communicating directly with the external air. So in this thoracic cavity is open, which may lead to pneumothorax where air enters the pleural cavity. So coming to regional part by part of chest regions. So first is the ribs. So any blunt usually may result in a fracture of the ribs. So if there is a compression from the front to back, so that if there is a ribs fractures from front to back, in the from sternum to vertebral regions, the rib usually fracture in the lateral side. So usually the rib fracture at the lateral side, and if it is from back to front, then the ribs tend to fracture near the spine. And if the fracture, if there is a force from the side to side, then the ribs will fracture near the sternum or near the spine. Rib fracture can also be artifactual due to cardiopulmonary agitation. So CPR, whenever the CPR personals are done, because of violent compression near the chest region, so sometimes artifact refracture artifacture can be occur. Multiple unilateral bilateral fracture can lead to flare or stove in chest with consequent paradoxical respiration. So whenever there is a fracture of the ribs, so when a person try to breathe in or expire, ribs do not move because of fractured ribs. This lead to flare chest or stove in chest. This also results in paradoxical respiration, in which the area of chest around the fractures may be seen to move inwards on inspiration. So whenever in normally when person inspires, chest cavity expands, but in flare chest, when the ribs are fractured, the rib doesn't move freely. Instead of that, it depresses in inspiration. That is called as paradoxical respiration, which is commonly seen rib fracture or called as flare chest or Sterling chest. Flare chest occurs when at least three consecutive successive ribs are fractured at 2 points. So, in rib fracture, when there are more than three ribs are fractured at 2 points, then it is written flare chest, where whenever the person breathes, the region near the fractured rib is caves in, so it becomes depressed instead of instead of expanding. Complication of rib fracture. One is the flare chest. Then there is if the fractured ribs protrude inside the pleural cavity, it may open the pleura, leading to laceration of intercostal blood vessels and pneumothorax. Blood may enter the pleural cavity, or there may be laceration of lungs with pneumothorax or hemopneumothorax. Blood, air may enter the chest pleural cavity. Then impaling wounds of the heart can also result. Then the fractured rib part may pierce the heart, leading to pleurisy and pneumonia. Now coming to injuries to the sternum. Fractures sternum are not common. They may be caused by direct violence and usually occur transversely. So usually the sternum part is well protected. So usually the sternum, it doesn't fracture easily. So there may be fracture only when there is a direct force applied to the sternum, and usually they get injured by because of bending, awkwardly bending, and result in transverse fractures, or by indirect violence as a result of forceful flexion of or extension of the body. So if the body is flexed forcefully in flexion or extension, it may fracture, usually in the transverse region. In the artificial respiration, that is CPR, sternal fracture may occur at the level of third or fourth intercostal space. So at the level of third or fourth intercostal space, they usually get fractured. Coming to injuries to the lungs, compression of the chest or blunt weapon trauma produces contusions or laceration of the lungs. A wound of the lung causes frothiness of blood which issues from the mouth and nostrils during coughing. So any injury to the lungs can be seen as a frothiness in the blood in the frothiness coming from the nose and mouth. Sudden compression of chest may produce countercoup contusions, that is injuries opposite to the point of impact, because maybe there, leading to violent displacement of air in the lungs to the posterior surface near the angles of the ribs. Stab wounds of the lungs usually are not fatal unless a major pulmonary blood vessels have been severed, and then unless that, even there is a stab in the lungs will not cause major damage, it will not be fatal immediately, But if there is any blood vessels are ruptured, it may lead to hemothorax or hemopneumothorax. Spontaneous pneumothorax, that is blood entering the pleural cavity, may occur following rupture of any emphysematous bullae. So emphysematous bullae are seen in case of COPD, that is chronic obstructive pulmonary disease. Sometimes there may be air-filled cavities may be found near the lung regions, which may rupture, leading to pneumothorax. Tension pneumothorax is seen when leak in pleura have a valve-like action. Air is sucked into the chest wall at inspiration but cannot escape on expiration. Sometimes, because of valve-like action, whenever the person inspire, the chest expands, but while expiring, it doesn't. The ruptured part of the pleura will form like a valve and closes, and it doesn't allow the air to expire out, leading to expansion, leading to tension pneumothorax. Sometimes there is iatrogenic pneumothorax, that is the cause is because of doctors, may occur by external cardiac massage, percutaneously introduced subclavian catheters, and continuous ventilative support. So these are all lead to pneumothorax, that is during conducting cardiac massage, that is in the CPR, or introduction of subclavian catheters. This may all lead to pneumothorax caused by the during treatment procedures. Respiratory lung is a condition. It is seen after severe head injury where the victim has been maintained for some time in respirator. There are areas of collapse and hemorrhage with the formation of hilar membrane in the lungs, which is called a respiratory lung. So this is seen in chronic patients who have been severe head injury, who are on ventilator support. There are regions of collapse in the lungs and hemorrhage with formation of hilar membrane in the lungs, which is considered as a respiratory lung condition. Now coming to injury to the diaphragm. Wounds of the diaphragm result from bullets or weapons which penetrate the cavity of the chest or abdomen, or it may be caused by severe blunt trauma to the anterior chest, or severe sudden blunt abdominal trauma with increased intra-abdominal pressure and upward displacement of abdominal viscera, or from during fall from height from compression of the tongue. So any of the one of the regions diaphragm may be injured by direct violence of the diaphragm, or injury to the anterior chest, or injury to the abdomen, which may increase the intra-abdominal pressure and may push the diaphragm, or when the person falls from the height and because of that there is compression of the trunk. These all may lead to diaphragm injuries. Laceration may be unilateral or bilateral, or it may be in the anterior regions or posterior region of the diaphragm. Now coming to injuries to the heart, contusions and lacerations of the heart may be caused by direct violence on the chest region, or by compression of the thorax, or when a driver is forcibly thrown against the steering wheel. So any blunt injury to the chest because of sudden compression of the thorax, direct violence on the heart, or whenever the person is suddenly stopped in a road traffic accident, the steering wheel may compress on the chest, leading to contusion of the heart, contusion or laceration of the heart. Cardiac contusions are usually seen on the anterior surface of either ventricles or interventricular septums are commonplace. Next part is the right auricle is also commonly seen as contused since it is anteriorly placed. Countercomp contusions are seen in the heart are seen over the posterior wall of the left ventricle when heart is compressed against the vertebrae. Countercomp, that is injuries opposite to the point of injury, are seen in the posterior wall of left ventricle when heart is compressed against the vertebrae. Contusion may cause sudden death from ventricular fibrillations, or they may cause progressive circulatory failure and death after few hours or days. So usually even minute contusions can cause death because of ventricular fibrillations, and it may also lead to progressive circulatory failure. Foreign bodies such as bullet may remain embedded in the myocardium for years without causing any symptoms. Sometimes the common site for traumatic cardiac ruptures are the right auricle, right ventricle, left auricle, ventricle septum, and valves. So commonest is the right auricle and right ventricle, which are seen anteriorly, others where the cardiac ruptures. Then left ventricle, ventricle septum, and valves are the least common places where traumatic cardiac ruptures occurs. The only natural cause of rupture of heart is softening or thinning of the infarctions, which generally occurs in left ventricle. So commonest, if the person has an infarction, it may lead to thinning of the septum ventricle, which may lead to naturally rupture of the heart, which is commonly seen in the left ventricle. Stab wounds of the hearts are dangerous and lead to immediate death. If the right ventricle is pierced, the thickness of the muscle wall may restrict the bleeding, allowing time for surgical treatment. So, since the left ventricle is thick, as a muscular wall is very thick, it may prevent continuous hemorrhage, which will allow for surgical treatment. But a stab on the right ventricle is more rapidly fatal. Blood escapes the wound and cause hemopericardium and cardiac tamponade. That is, compression of the heart may result because of hemorrhage compressing the heart, and heart may stop beating, leading to death. Even minute one, that is 150 ml, average 4 to 500 ml of blood can cause death by increasing intrapericardial pressure, producing mechanical interference with ventricular contractility. So, bleeding from the heart may accumulate near the pericardium, which may compress the heart, leading to death. Right ventricle is more likely to be wounded as it is exposed in the widest area towards the front of the chest. So, commonest right auricle, right ventricle are the commonest area where injuries are commonly seen. Cause of death in heart injuries are mainly the hemorrhage, that is, any stab injuries may lead to hemorrhagic shock, then cardiac tamponade. Cardiac tamponade is where the heart is compressed because of accumulation of fluid. It may be blood or any fluid in the pericardium cavity. Then there is cardiac concussion or commotio cordis, also known as commotio cordis. Cardiac tamponade, which it presents with three signs, which is called as Beck's triad, with low arterial blood pressure, increased intravenous pressure, and distant heart sounds. So in this condition, there is hypertension occurs because of decreased stroke volume, jugular venous distension due to impaired venous return to the heart, and muffled heart sounds due to fluid inside the pericardium. So since heart in the inside the pericardium, there is fluid accumulation, heart is compressed because inside the pericardium, leading to cardiac tamponade, which presents as low arterial blood pressure, increased central venous pressure, and distant heart sounds because of, since heart is pumping is reduced, there is increase in jugular venous pressure, which results in impaired venous return to the heart, and because of that is muffled heart sounds because of fluid inside the pericardium. Next complication that is cause of the cardiac concussion or commotio cordis. It refers to sudden cardiac death following blunt trauma to the chest. It is often associated with sports and in young athletes. It usually occurs when impact occurs at an electrically vulnerable phase of the cardiac cycle during early ventricular reposition. So, if there is a sudden impact on the chest, sudden person may die immediately. And usually, when it occurs, when if the injuries occurred in the electrically vulnerable area of the electrically vulnerable phase of the heart, that is the ventricular reposition. At this point, if there is an injury, sudden injury, it may lead to sudden stoppage of the heart, leading to death, which is called as cardiac concussion or commotio cordis. Now coming to injuries to the blood vessels, wounds of aorta or pulmonary arteries are rapidly fatal. Rupture of aorta commonly occurs at the junction of arch and the descending parts, just beyond the virgin of the left subclavian artery, and is due to violent compression of the chest. So mainly in case of any compression of the chest may lead to rupture in the aorta, mainly near the arch and the descending part, leading to bleeding, hemorrhage, and shock death. It is common in traffic accidents and less common in fall from height and crushing chest injuries. Spontaneous rupture of aorta may occur in case of some local diseases, mainly in case of infarctions. Now coming to injuries to the esophagus, it is rarely ruptured near the lower end due to mainly in the lower end due to severe violence or vomiting is the commonest cause of rupture of esophagus. Rupture are usually single longitudinal splits on the lateral posterior wall. So usually the common injury to the esophagus is the rupture of esophagus, and it may be because of violence or vomiting seen as longitudinal slips on the lateral posterior wall. Laceration can also involve mucosa. Only mucosa complete wall can also be perforated. Perforation of esophagus can result from passage of instruments also. Iatrogenic cause may be there. A punctured wound of esophagus may produce mediastinal and cervical surgical emphysema and fetal mediastinitis. So any puncture in the esophagus may lead to contents of the esophagus may be dispersed inside the mediastinum, leading to emphysema and also mediastinitis, due to which the person may die. Next, lastly, the complication of chest injuries. Complication chest may lead to pneumothorax, that is, air may enter in the thorax, pleura, or blood may enter, or chyle may enter, or there may be interstitial emphysema, there may be arterial air embolism, cardiac tamponade, air embolism, or interparenchymal hemorrhage, or infections. So these are all complications of chest injuries, and because of injury to the chest, the person may go through any of these complications and may die because of complication of chest injuries. Medical importance of chest injuries. Examination of wound can help to assess motive of the person. Usually they are homicidal in nature. Any chest injury, commonly it is homicidal. Then there is accidental is common because of road traffic accident, chest compressing the chest, that is steering wheel compressing the chest. Rarely it is suicidal. Common is the homicidal and accidental. Mostly these injuries are grievous in nature. So any injury in the chest regions are grievous because it is life threatening. So life threatening injuries are common if there is chest injury, since commonly the chest common injured area is the heart. So even the smallest contusion on the heart may lead to death. So it is life threatening, it is grievous in nature, causing death immediately or remotely due to complications. These are my references. Thank you.